Okay. Good morning, everyone. This is Sharon and Robert Porter from Trucking and Business. And we have a special guest on today that's going to be talking to us specifically about healthcare for truckers. So, Mike, why don't you go ahead and introduce yourself and you can take it from here.
Absolutely. Thank you. Thank you guys for having me. I'm always excited to connect with, people on stage, off stage, and just, contribute to what they have going on. I really believe in the mission here, trucking and business. And anytime I can help, I'm happy to be of service to you guys. But in case you don't know me, or I guess for the sake of conversation, you don't, I'm a Health Unicorn Mike, the guy with the unicorn on his head. I'm a nationally licensed, award-winning health insurance broker. I offer affordable health coverage that creates tax deductions for small businesses. I've helped thousands of entrepreneurs and their families. I'm actually licensed in 33 different states. I've been in the industry for 9 years, and I have access to 95% of plans available. So let's talk a bit about insurance. That's the topic of the room here. Help specifically truckers, right?
It's amazing what you really don't know can really hurt you.
Can hurt you, yes.
And this is why we have professionals on, like such as yourself and other people as well, is because we've been in the trucking industry, me and her both, for over 40 years combined together. And we have seen a lot of things transpired in this industry that have literally taken things away from the truck driver. When people see truck drivers, a lot of times they see big dollar signs and they just trying to get as much money from them as they possibly can and not getting the benefit for what they're paying for. And so, our mission is to bring people in our space or in the area that we operate in to give insight to help us to move in a positive direction. So, brother, I tell you, you just keep on flowing. What you have next, just keep on rolling. I appreciate everything you're doing.
Not a problem. Not a problem. For the record, I'm not bashing any company. I've worked for majority of them. I've represented them all as carriers. I have FMOs with multiple companies. I want you guys to think I'm bashing Blue Cross Blue Shield or Aetna or Cigna or anybody. I more so just want you to understand how insurance works, because that's going to be universal either way. Okay. So back to it. So we talked about, now we've understood employer coverage, right? Now we understand the difference between the employer coverage and the individual market. Individuals, again, under the 50 employees. Now we understand how much our network matters. Well, now let's talk about shopping for insurance, right? I think that's the third critical part there, right? So you have, again, the 3 ways: employer coverage, group plan. Then if you don't have over 50 employees, you want to do, then things are going to be done on an individual basis. When you do things on an individual basis, there's 2 ways to get full coverage in the United States of America. The first option is a public option. The second option is a private option. Now, a public option is going to be an income-based option. It's typically designed for those that make under $34,000 a year. Mind you, because of COVID, they have increased that up to about $47,000. But still, that's the threshold. Typically, if you're in the trucking space, you're making much more than that, you don't qualify for what they know as a subsidy. So the public options are income-based. They're primarily designed, again, for those making typically between under $34,000 to $47,000 a year, or those that have chronic health conditions. A chronic health condition is a health condition that lasts over 6 months. Interesting fact, random nugget for the room: maternity counts as a chronic health condition because it lasts for more than 6 months.
Wow.
So if you're pregnant, planning on becoming pregnant, you want to go with a public option comparatively. Okay. Then you have your private options. This is what I specialize in. This is what I primarily focus all my energy and effort on: private health insurance. So private options, very simple. If you can pass, those are health-based. So if you can pass 10 to 15 medical questions, I can save you 30%. Okay. Medical questions are pretty generic. Underwriting is not, I can't really give you specific ones because different companies have different rules there. But if you can pass, you don't have to be an Olympian. Nobody's saying, hey, I need you to sprint 50 miles to get this insurance. That's not what we're saying. I'm saying, are you diabetic? Are you taking medication that's $5,000 a pill, right? Or do you have something that's a chronic quote unquote condition. High blood pressure doesn't count. I can still more than likely, 90% of the time, I can still do something for you. But guess what? Anytime that there's a yes to a medical question, what that means is it's going to be more information required. That's what underwriting is. We need more information in order to make an informed decision. So you may have to pay more money. You may get declined. I need more information because you said yes to one of my 15 quick questions, right? Doesn't mean it's a no. It means it's a maybe. And depending on what you have going on, it could be a no, or it could be a contingent. Like, hey, yes, you can get this, but only this person can get this because of this, right? Or yes, you can get this, but only at this price point. Or you know what I'm saying? With high blood pressure specifically, people they're a random nugget for the room. We're more concerned about BMI than I am about a lot of other things. Like that's the follow-up question there. Okay, high blood pressure. All right. What is your approximate height and weight? Because they typically correlate. So in insurance in general, there's things known as comorbids, which means different things that allows you to not be qualified for insurance. This exists with every different company. Every different company has different rules in regards to how they operate. This is why when somebody's like, oh, I'm going to do my research, but they're not in insurance, it sounds silly to someone that speaks insurance. Because by all means, feel free, do your research. Where are you going to go? What are you going to look at? What do you know? Are you getting a PFFS? Do you know what a PFFS is? Have you watched the video with Trucking in Business so you can know the percentages of a PFFS versus a POS versus EPO versus HMO and understanding that the best one that you could possibly get is a PPO? Have you done that? If you haven't done that, right, then it's going to be very difficult for you to even do rudimentary research because what you're going to see is, oh, random company A says they're going to charge me a random amount here. That sounds great. I can afford that. Stop buying based upon your budget. Start buying based upon your liability. Also, there are potential tax deductions that exist. You're in business. You're a trucker. Random nugget for the room. Your people that need to be on your money team outside of trucking and business needs to be a CPA. These are the people that save you money. A financial advisor. This is typically also going to be your life insurance person as well. There's ways that you can, with insurance, that you can fund your entire business if done appropriately. Got to talk to the right people. Oh, always, if you can, try to talk to a broker more so than an agent. A broker means they have more than one company. You want somebody that can represent your interests. You want to shop your options, talk to the broker. Don't talk to 50 agents because guess what? Every agent is going to treat and approach things differently. Like when I sell a policy, I sell you the best plan that I possibly can at the lowest price point that I can. Because for me, it is more important to make sure that you are taken care of, that in your time of need, you're covered, that you're not dealing with extra bills and coming out of pocket, that you have tax deductions, that you're able to see the doctors that you want to see, that you're not dealing with the frustration that happens by you having not had this conversation. I make sure that that's not my issue. I want to handle it on the front end. I want you to have the best that you can. So that way on the back end, the call is thank you, Mike, as opposed to, oh my goodness, this is terrible. Why'd you do that? Random nugget for the room. Most insurance is customizable. So when you're saying, I want this and I want this and I want this, those are part of the plan. They're known as riders in insurance. Riders. So with the right riders, you'll be riding along. But if you talk to the wrong person that doesn't know what they're doing, that hasn't been in the industry 9 years, that hasn't won awards, that's an agent versus being a broker, guess what? You might end up having customized yourself out of real insurance. Or you might end up doing this. So we're going to talk about private options. We're going to delve into that. And then I'm going to slightly talk about short-term options, just so people can be aware of what they are in general. Okay? So your network is your net worth, right? Obviously, I can help you. Been in the industry forever. On top of that, I have thousands of clients. On top of that, I'm here to help you, right? I have a fiduciary responsibility to help you. Now, every agent is going to operate in whatever way that they feel like it's going to help you the most, right? But maybe that they think the way that helps you the most is by saving you that $20. I think the way that helping you the most is saving you those thousands of dollars. So your approach is everything. Don't get cheap when it comes to your insurance. As a matter of fact, stop getting cheap when it comes to your insurance. Random nugget for the room. We asked about price. typically with the cost of insurance, you're typically dealing with about $10 per year age. This is in regards to not group insurance, when we're talking under 65, individual market, public-private, okay? You're usually dealing with about $10 per year age. So, for example, myself, this is a regular person. You got a yes to one of those questions? Again, that may be a fluctuation. That may be a variation. That may be where the variation happens. Instead of $10, maybe it's $12, maybe it's $15, maybe it's $20. It depends on how these questions go, right? So public options, interesting enough, random nugget for the room. Public options have no medical questions. They're what's known as guaranteed issue. So Obamacare is no public option. Again, those are income-based, designed for those that make under $34,000 to $47,000 a year, or those that have chronic health conditions. If you're not fitting into any of those categories, and you still decide to go that route, typically speaking, you're going to see an increase of about 400%. Because those plans are not designed for you. An option that is designed for you, especially as an entrepreneur, you're in the trucking space. Guess what? Let me tell you what you need in insurance. I'm going to tell you straight up. You're a trucker. This is what you need. You need a PPO. We already talked about that, right? Outside of a network discount, the reason you need a PPO is because it travels with you nationwide. If nothing else, if you hear nothing else, a PPO travels with you nationwide. So if you're a trucker and you decide to get, let's say, for example, an EPO, because random company said it was $200 a month, right? Again, you're 53. I told you insurance is $10 per year age. Yes, but this company said I can get it for $200. Is your income under $47,000? No, I'm a trucker. Okay. Are you self-employed? Do you work for a company? No, I'm a trucker. Are you an owner operator, or do you have your own authority? I'm a trucker. I'm an owner operator. I'm working for myself. Okay. So, do you have a chronic health condition? No. So why are we talking about the public options? Those need to be immediately eliminated from your vocabulary because you don't fit into one of those that's going to make sense for you. All right? Now, if you do, go that route. Go ahead. Sorry.
Excuse me. Let me interject there because you mentioned one thing that's really sticking out to me, Mike. You said your network is your net worth.
Yes,
and the approach is key because the thing about it, when you, as I hear you speak, I keep thinking of the song that a lot of people know of, and I'm dating myself, Stevie Wonder, based on superstition.
Superstition.
And that particular
I can't sing, but don't judge it.
That particular song, within it says, if you believe in things that you don't understand, then you suffer. And that part of that song has always resonated with me because, of course, the rest of the song, superstition, but that particular part, if you believe in things that you don't understand, then you suffer. And a lot of things that we have believed in, especially coming from, corporate America or, working under someone else, in a secular business. And, we decide to, go in for ourselves, which we have. But we bring that same mindset because we didn't know about anyone like you. That there are options that we have, and specifically the options that you're speaking of. So I just wanted to interject that in there because, wow, this is some golden information that you're giving here. So you could continue on, Mike.
No, I loved your point. That was awesome. It was completely relevant and completely accurate and a pro for the conversation. And plus, that's one of my favorite songs. So never feel, you can't never disrespect Stevie. Stevie's a man. So, so like the age of myself there as well, I guess, in that capacity. But so yeah, get yourself a PPO, ideally, and even more importantly, get yourself a health-based PPO, because you might be able to find a PPO in a public option. But if it didn't fit into those categories, then again, it's going to cost you about a 400% increase. I had a person I was talking to today, and he was, regular person. Let's just say he was 45, had a kid, right? I was able to save him $600 a month compared to the option that was available via the public option.
Wow.
Wow.
$600 a month. He saved in 1 year more than he paid for insurance his past 5 years.
Wow.
Let me ask you a question. Is this PPO, is that based on your health now that you are qualified for? So there's certain questions that you ask. And let's say, for example, you are diabetic, but yet you are seeing a health provider based on your nutritionist and a health provider. Does that affect the outcome of your of the company's answer to insure you or not? I mean, how would that work? I mean, you understand what the question is?
Yeah. So in essence, you're asking, if I'm trying to fix the problem, is there a way to get better? Is that what you're asking?
Well, what I'm asking is, if I'm trying to fix the problem, will I still be considered for the insurance for the PPO, or do I have to go another route?
Okay.
If I'm trying to fix a problem, or if I'm working on a problem, I mean, how does that work? Or do I have to go to the public option?
My answer to you would be, it would depend on the problem. Different problems are treated differently. For example, there's a medication out there that's $5,000 a pill.
Good Lord.
If you're taking a $5,000 pill medication, I sincerely doubt you're going to qualify for a health-based option, because the record is indicating that you're not healthy. So, but let's say that you can't be actively getting treatment and qualify for a health-based plan. So it's going to be based upon where you're at now, not where you're trying to be. But once you get there, we can reevaluate. We can say, hey, guess what? You had high blood pressure, right? And you were initially on 3 medications. You were on a metoprolol, a lisinopril, atenolol, whatever you're on, right? Well, the combination together, this is not accurate. This is just in general, but that combination together is a comorbid. You're not able to get the insurance, right? And then you say, all right, perfect. And then you go to the gym and you start eating green leafy vegetables and you start drinking water, right? And then your weight goes from 230 to 210, right? And your BMI is down, right? And you're healthier, you're fit. You're like, oh man, I'm jogging in place, Might do a little shadow boxing, right? Awesome. Well, guess what? When you start taking your vitamins, guess what? Your BMI may match up now, and more than likely, they're going to take you off of one of those medications. Random nugget for the room. Stability is important when it comes to insurance, but it depends on the company, because different companies have different valuations. I'll give you an example, randomly specific. Over 65, there's a company known as Mutual of Omaha who has a 222 rule. This is generic information people could find out, no problem. So it's not like, it doesn't, my license isn't at risk for explaining things to you. But Mutual of Omaha, for example, has a 222 rule, which means that you can't be taking more than 2 medications. You can't have more than 2 conditions. You can't be taking more than 2 medications per condition, and you have to be stable for at least 2 years. That's on the Medicare supplement side. Randomly very specific, right? Guess what? Nobody else has that rule. Also, guess what? Mutual of Omaha has 30% less than the other companies because of that rule. So it depends. It's going to be a better answer to give me, for me to give you specifically, as opposed to giving you a specific answer there, only because everybody's conditions, their approach, their treatment, their doctors, the plan that they previously had before talking to me is all different, Okay. But I will say, again, chronic health condition, something going on, right? Over 6 months, or if your income is under that 47,000, I'm typically going to recommend for you to go for a public option. Now, within the public option, I'm still going to recommend a PPO, but be aware that the PPO on the public option is going to cost you probably 40% more than the PPO on the private option, because it's all about risk mitigation, not just for yourself, but also for the insurance company.
Got you.
So, so we went through the networks, right? We understand the coverages. We talked about the public option there, what that is, how it entails, what Obamacare is. You can use websites such as healthcare.gov. You can use websites such as healthsherpa.com. Those will get you to the public options. Still probably, again, won't know what you're looking at. But just a random recommendation from a health insurance broker, you bare minimum want to go with the silver plan, or everything that you want to do, you want to at least compare it to a silver plan. Anything below a silver plan, typically, in my opinion, is not necessarily worth it, because there's going to be more holes, more gaps, more money that you pay out of your pocket. That's just how the levels work. That's why I typically recommend bare minimum a silver plan. Going with the private option. So private option, again, health-based, has 10 to 15 medical questions. You save about 30%. What else happens with the private option? Why else should I go there? I'm saving 30%. Well, again, you're getting that network. Now, also, let me tell you, in the public option, or in general, in every area, not all options are available. I can tell you that. But I can also tell you that if you can pass 10 to 15 medical questions, more than likely, I can find something for you. More than likely. 95% of the time, 98% of the time. If your income isn't below that threshold, you're a truck driver, you shouldn't be making under $47,000 a year if you're a truck driver. If you are, make sure you guys highlight Trucking in Business so they can help you. But you're not in those categories, then don't go that route, because you're going to pay more money. All these people that are calling you on the phone, oh yeah, you're going to buy insurance, you're going to buy insurance, you're going to buy insurance, blah, 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 and they're blowing you up. All of them only have access to the public options. Random nugget for the room. There's only 4,000 people in the entire country that have access to what I have access to.
Wow.
Of those 4,000, I was number 32 in the country last week. Of those 4,000, I was number 2 in the region the week before that. You don't have to go with me. You can go talk to somebody else. But be aware that they're more than likely, one, not going to have access to what I have access to. 2, not going to approach insurance in the way that I'm approaching insurance, by meaning to help you on the back end and definitely still save you money on the front end, right? 3rd, and more importantly, they're probably not going to be able to compare and tell you the differences between over 65, under 65, Medicare, Medicare supplements, Medicare Advantage, and then the under 65, the private, the public. You know, they probably wouldn't have represented 28 different carriers like I have. They probably wouldn't have been in the industry 9 years. And they probably wouldn't be award winning. Talk to whoever you want. No pressure. But I am here to help you. Just thought you'd like to know. You have the private option, again, health-based. So on top of it being a PPO, on top of it saving you 30%, it's also going to include things like paying your deductible for you, first dollar coverage, letting you see what the doctors you want to see, getting you that 80% in-network discount, potential tax deductions or write-offs for your business. All of these things are going to be entailed on the health-based option. Now, you want to go with a full coverage health-based option. Let's be specific. Private, health-based. There are private options out there that are still health-based. Still going to ask you some questions, right? But they're going to ask the questions on the back end. Those plans are known as short-term plans. Let's talk about short-term plans. So a short-term plan, 85%, random nugget for the room, 85% of all claims in the United States get denied on a short-term plan.
Wow.
85%. People buy them all the time, because this is what they tell you. This is what the person that's on the phone that doesn't speak insurance. This person probably makes $15 an hour. They don't know what they're talking about. They're not a broker. They're not in this one. Going to talk to somebody that's licensed. You're going to talk to somebody that's licensed in multiple states, right? Most agents you're going to talk to have 1 state, 2 states. I have 33 states. At one point, I had 50 states, but private insurance isn't offered everywhere. Another random nugget for the room. Private insurance is not offered everywhere. Different states have different rules for insurance. For example, Maine or Massachusetts, different rules. California, different rules. But you wouldn't know that because you're not a broker. But if you talk to a broker, specifically, it doesn't got to be me. Talk to whoever you want to talk to. I don't care. But talk to a broker. Don't just talk to an agent, right? So 85% of all claims get denied on a short-term plan. Why is that? Why do 69% of all bankruptcies in the United States are due to medical debt? Why is that? Because they don't know how to use their insurance. They're doing things like going to the emergency room for cutting a hand. They have no idea what their network is. They just bought it because somebody called them on the phone, or they saw a TV ad that didn't explain anything. They didn't forget doing your research. You don't know what your research is. Talk to a broker. That's what their job is. A broker is doing the shopping for you. Like, for example, if you buy real estate, you can talk to an agent, right? And they'll show you like one house at a time. But you know who the agent works for? A broker. My point exactly. So talk to a broker. Okay. Also, most people go broke again, they don't know how to use their insurance. They're getting the wrong plans. They're getting themselves a PFFS when they should have got a PPO. Now you guys understand that language. Now when I say that in a room, you'll be like, you shouldn't do that. That's terrible. That's a bad idea, right? Or they have no idea how to use their insurance. For example, they'll have an auto claim. Random nugget for the room. When you have an auto claim, you got in a car accident, not with your truck, it's a car accident. What most people do, and what most people do incorrectly, is they go to the hospital, which is fine, and they give them their medical insurance card. It's not a medical insurance claim. It's an auto claim. They need to know who those bills go to. That's why they're asking you for your card. So people use their plans the wrong way. They don't understand insurance. They don't understand the networks. They don't know how to use insurance. They go to the wrong places. Random nugget for the room. Use GoodRx. You save about 90% discount on your medications. Random other nugget for the room. GoodRx doesn't work. Order from Canada or Turkey or Mexico. Probably save you an additional 50% there comparatively because it's not manufactured.
God Almighty. Wow.
Random future other nugget for the room. Your lab work, your diagnostic testing. Go to Quest Diagnostics. Go to Simon Lab. Don't go to a place that's attached to the hospital because of what? That facility charge that we talked about earlier. Wow. So there's levels to this in regards to insurance. But if you don't know, one, who you're supposed to talk to, two, you're not tapping in with Trucking and Business, and three, you're just, oblivious to what's going on, which is fine. This is why professionals exist. This is why I'm here. This is why I have a career, because I speak this language that other people don't speak or don't care to speak. And I've spoken this language fluently for almost a decade and helped thousands of entrepreneurs just like yourself.
On that note, tell them how to get in contact with you.
Absolutely. You can check out my website. You want to know something about insurance? Check out my website, www.healthunicornmike.com. You can, on my website, you can book a consultation with me. 15 minutes. If it spans for an hour, it's fine. I'm here to help you. I'm not here to rush you. I would rather help 12 people a day for an hour per person than to try to pressure everybody and talk to 45 people 15 minutes and then they cancel coverage. You canceling coverage hurts me. I want to help you. So I want to make sure, again, this is why I sell, and I stand by this. I sell the best insurance in the whole country, best coverage in the country. I'm going to sell you the best plan that I can at the lowest price point that I can with my intent to help you at all times.
So again, go over your website again. Is there a phone number hooked to that, or is it just the website itself?
And the website will connect you to me directly.
Okay.
Everything attached to my phone. So if I get a notification that, hey, you went on www.healthunicornmike.com, that you booked a consultation, it'll connect you to my Calendly, right? On my Calendly, we get a 15-minute consultation. You'll book it. It'll show up here. This is a random key. Calendly has a sense of humor. Please put your phone number if you need me to call you in regards to making this appointment. Otherwise, I'll reach out to you, no problem. But we may be missing each other. I'm crazy swamped. Open enrollment is ending January 15th. Last point, I know we were probably in this room, but open enrollment is ending January 15th. You can shop all the options. The public options are all available right now. Short-term options are available right now. Well, some of the short-term options are available. The full coverage, health-based PPO options are available right now. If you wait until January 16th, instead of having 60 options to choose from, you probably have about 4. Now, I may still be able to do something. Most of the time, I actually can. I can probably get you insurance all year round. But you may not be able to get, maybe you're in a better situation where you need an income-based option, right? Unless you have a special enrollment period, I can't get you that at a time. It's obviously random insurance jargon, but my point is, January 15th is your deadline. You can call me January 16th. I'll still make sure you're covered. I still have those health-based PPO options available. But be aware, your shopping's gonna be a lot more limited. Your shopping cart right now has all the items in the grocery store. You got your broccoli rabe, every vegetable you can think of right there, right? And I'm the agent who apparently works at this grocery store of insurance. I can pick out and say, hey, this is the best tomato out of all of these tomatoes that you're seeing here because of this, and this, right? Or you could talk to every other person that owns a grocery store in all the country that doesn't have access to these tomatoes, okay? They only have access to ketchup. You can get ketchup, but it's not going to be that tomato. If you want the tomato, or better yet, if you want the insurance, right? If you want the best coverage that's available, you want to pay the lowest prices that are available. You want dental, you want vision, right? You want a plan that pays your deductible for you, so you're not having to deal with it. You want something where an accident only costs you $100. You want to be able to see any doctor that you want to see. You never want to deal with prior authorizations, pre-approvals. You want to have that 80% in-network discount versus a 10% type of plan. You want full coverage instead of a short-term plan. Check out my website, www.healthunicornmike.com.
So basically, are you saying that during open enrollment, because I've never completely understood why, what was the difference between getting insurance, outside of open enrollment? So basically, are you saying that this is when basically health insurance go on sale?
Not on sale. Okay. That wouldn't be an accurate statement.
Okay.
The reason I say that is because typically during open enrollment, you're going to see more increases actually than you are typically for the rest of the year.
Okay.
Because the insurance companies knows that this is the time that you have to shop for insurance as well. But that's why if you go with a health-based plan, you're not typically dealing with that. So last point, at $10 per year age, right? That's what we talked about. Mm-hmm. That's the public option. So for example, I'm 33, right? 33, $10 per year age, looking at $330. Then you want to add $50 to that, right? $50 give or take. So you add $50 to that, that's $380, right? That $380 is going to be the least expensive option that I have available for a public option. Then you want to add $150. That's going to be the range. So between $380 to $530, that would be for myself, just for me. If I had went with a public option and I didn't qualify for a subsidy, that under $47,000, if you're under that threshold, you qualify for what's known as a subsidy, in which case the government pays for part of the cost of your insurance. Sometimes up to 100%. But again, it's going to be based upon your income. Other ways that you can get 100% coverage that the government can pay for is Medicaid. You can qualify for Medicaid and Medicare at the same time. Medicare is over 65. Medicaid is low income, chronic health conditions, similar capacity. Again, though, not all doctors take these plans because they're guaranteed issue, right? Typically dealing with a different crowd, a different dynamic. And on top of that, they may not be in network. They maybe say, hey, I don't really want to deal with that. I want to deal with these people. I want to deal with the entrepreneurs, right? You're an entrepreneur. You're taking care of yourself. You're a regular person. Again, health-based PPO is the way to go. So $10 per year age, $50, you're going to add that there. Private option is going to work the same way, $10 per year age. Now you want to minus $50. So that same example, I'm 33, $10 per year age, $330 minus 50, it's going to be about $280. That $280 is going to be a PPO. We can see any doctor. It's going to include dental and vision. It's going to travel with you nationwide, and it's going to have a tax deduction. That's the difference between public, private, group, and just whole thing shebang with insurance. Hopefully that was helpful.
Outstanding. Wow. Wow. Man, I'm glad that we had this interview with you. And, again, I don't want to hold you up because I know you have a newborn. And again, congrats, man, to the baby and to you and the family as well. And I will be looking forward to seeing you on Clubhouse, talking on Clubhouse, and man, I'm glad that we ran across you. I tell you, you just really helped us out. And I don't know if you have any other thing that you need to add. So,
well, we're actually going to have Mike on Clubhouse with us talking about healthcare for truckers January 4th at 11 a.m. East Coast time. So we're going to go into that. And of course, we're going to be putting all of his links below as well. So I've definitely enjoyed this interview with you, Mike, because you have definitely given us insight. And I believe it will give a lot of insight to a lot of truckers, fleet owners, owner operators, across the board on what type of insurance that we need to be looking at. And it's definitely making me rethink about the insurance that we have. So definitely. So we'll say, you know, thank you for this interview today. And, you know, we welcome you guys, or thank you guys for tuning in to Trucking in Business today. And we look forward to, you know, the next interview, the next topic that we'll have. And with that being said, we'll say, be safe.